Hi guys, I'm just gonna let a couple people join us. So I'm gonna give it a minute. Thank you for coming. All right. Hi there. I'm gonna turn off your video and when it's your turn, I will ask you to turn it back on, okay? Thank you. So welcome to Mental Illness Awareness Week, everyone. I'm Danielle Angelari. I'm the Executive Director of NAMI Northern Illinois. Thank you for coming again. Um, each year, millions of Americans face the reality of living with a mental health condition. Yet mental illness affects everyone directly or indirectly. Despite the reach and prevalence of mental illness, stigma and understanding are also unfortunately widespread. That is why each year during the first full week of October, NAMI Northern Illinois and participants across the country raise awareness of mental illness. Each year we educate the public, fight stigma, and provide support, and each year our movement grows stronger. We believe that mental health conditions are important to discuss year-round, but highlighting them during Mental Illness Awareness Week provides a dedicated time for mental health advocates across the country to come together as a unified voice. This year, NAMI Northern Illinois will be focused on the fact that mental health care is essential. We want tonight to showcase as many local organizations as we can this evening as a resource for our community so individuals in need know there is help out there when they need it most. So each organization, a representative from it, will be given 3 minutes tonight, and I'm going to sound an obnoxious bell when their 3 minutes is up, and then we will get through. It looks like we have about 14 panelists, 15 tonight. So enjoy. Who do we want to start with? How about Lindsay? Do you want to start?
Sure. So I'm Lindsay Blackpool. I'm from Youth Services Network. YSN has been in the northern region, Rockford, Winnebago, Boone County region since 1982. We strive to improve the physical, psychological, and social well-being of youth and their families. We are trauma-informed, strength-based, and we provide services in the community and meeting the clients where their needs are. We have many, many programs, so I'm going to try and squeeze them all in 3 minutes. We'll try our best. So one of our programs is the Comprehensive Community-Based Youth Service Program. That is our crisis program, serving youth from ages 11 to 18 who are considered runaways. They're locked out from their homes, either by their parent or guardian. It's a 24-hour, 7-day-a-week program. We also have our shelter for youth age 14 to 21. We have the Bridge, which is for young men, and then we have our MELD shelter for young women who may or may not be experiencing pregnancy or parenting. And those two shelters are also 24 hours a day, 7 days a week. We also have several programs within the Rockford Public School District. We have our truancy interventionists who work in all of the schools throughout the Rockford School District, and they work with the families to resolve the issues that cause any chronic absenteeism. We also have our trauma therapists in select schools such as McIntosh, Constance Lane, Ellis, Welsh, and Lewis Lemon. They're working with students whose trauma has impacted their education, and then they also help provide support to school staff to understand the impact of trauma. We also have the behavior intervention specialists who are in many of the elementary and middle schools in Rockford, and their goal is to improve student behaviors using a connected school model. Parents and school staff can also request this assistance. We also have a transition advocate where youth are returning to the community with the Winnebago County Juvenile Detention Center or the Illinois Department of Juvenile Justice. And they help reintegrate back into the educational setting. And then we also have Parenthood Promise, and that's for families in Ellis Elementary School or Kennedy Middle School. The parents and children sign a pledge that children will graduate from high school. They provide wraparound services to the family. They do tutoring, summer camps, helping parents with employment, housing, other basic needs. We then have 2 counseling programs. We have our GIFT counseling program. The GIFT stands for Guiding Individuals and Families Therapeutically. And this is for a program for youth who have been either physically abused, sexually abused, neglected, are a victim of domestic violence. And in that program, we also serve the non-offending parent or guardian. Typically with this counseling program, we do serve a lot of families that are involved with the DCFS system. We also have our intensive placement stabilization program. This is specifically for kids in foster care. It's to design the foster child in their home so they're not bouncing from home to home. We provide counseling, case management, and then also wraparound services for the foster family. Then we also have a variety of juvenile probation programs. So we have our violence intervention program. This program is for boys aged 11 to 16 who have started having either school or criminal or family issues. It's an early intervention program to prevent youth from entering the juvenile justice system. We also have the Redeploy Illinois program, and this is for youth aged 13 to 18 who have committed 1 or more crimes. And then that would qualify for them to be eligible. And this is to prevent them from entering into the Illinois Department of Juvenile Justice. And then we also have our Day Reporting Center. This is designed to aid youth who have been incarcerated already in the Illinois Department of Juvenile Justice and integrating them back into their families in the community setting. So I know I have another coworker on here that's going to talk about her program as well. We do accept insurances such as Meridian Youth Care and some Blue Cross Blue Shield, but most of our programs are funded through Department of Human Services, United Way. We have many different funding sources. And I see Danielle, so is my time up?
Yeah, I'm sorry. I tried to play a recording, like a bell, but I don't think anyone heard that, so it's fine.
Okay.
You're good. You're good. All right. How about Chris? Do you want to go next?
Am I on?
Yeah, I'll figure out my bell too. So.
Can you hear me and can you see me, I guess is my question.
Yes and yes. You're a little blurry, but you're fine.
That's because I'm trying to sit back from my camera. I am in my pajamas after all. So I'm from Stepping Stones of Rockford. What we are most known for in the Rockford community is our residential program for individuals with severe and persistent mental illness. But we do provide other services as well, so I'll try to kind of outline that. So we serve adults over the age of 18. We get referrals from a lot of different entities, including our partners locally from Rosecrans. Oftentimes the individuals that are most appropriate for services at our program are individuals who haven't been successful with less restrictive levels of treatment. So people who maybe have done outpatient or seen a private psychiatrist and counselor in the community, and that wasn't enough support to keep them stable and out of the hospital. So the folks with more intense needs usually come to us. Oftentimes the services people are seeking are at the group home level of care. We do have 5 group homes serving a total of, let's see, 38, no. Anyway, adults in the group home environment. typically when those individuals then are stable in terms of their symptoms and have kind of regained functioning in their daily living skills, then we try to transition them to another setting within our program. So a lot of times where they're going are to a supervised apartment. So there are still staff 24 hours a day, but the individual has their own living space. Obviously, they have a lot more decision making when they have their own living space in terms of comings and goings. I kind of explain it that it's kind of like when you send your kid away to college, that some of the challenges that they'll face about making decisions, you know, who do I spend my time with? How do I fill my time? What am I eating? You know, freshman 15, right? That's the kind of thing that we start to see with our clients. It tends to be more than 15, but so, you know, gradually then they stabilize in that type of an environment where they're making more adaptive decisions for themselves and taking good care of themselves. And then we try to transition them out into community housing. We also have a program that serves adults over the age of 50 that has staff during the day, but not staff at night. So a lot of times referrals come to that program from nursing homes or from family members where they have a loved one who maybe was functioning more adaptively when they were younger and not so much as they're aging. Sometimes there are medically complex things going on. So then our outpatient program, we've really expanded our outpatient program in the last couple of years, mostly because there's just an increased demand for mental health services. And so people, while they've been waiting to try to get into a group home level of care, oftentimes want to give it a try in the outpatient program, you know, because it's still more services than seeing just a psychiatrist and a counselor. So in that program, we try to wrap services around that individual. They can be seen anywhere from, you know, 1 time a week to 5 times a week if they need to. They have access to crisis staff after hours. So our on-call people that can come around and visit them, or then, you know, more emergency services when applicable. So combined right now, we have about 160 clients, much, much smaller than Rosecrans, obviously. But I think that we have kind of our niche in the community and work cooperatively with them. So let's see, we take Medicaid for insurance, and we do have contracts with each of the managed care companies that are, you know, in our region. We do have a small contract with DCFS to serve their youth that are age 18 to 21. And so therefore we have youth care that we also accept in terms of insurance. What else should I tell you? We already talked about that the clients would have a severe and persistent mental illness to be over 18. I think sometimes you have the misconception. Danielle, why does it work on me? I was just going to say, we don't work with the developmentally disabled, and sometimes people mistakenly believe that we would take folks that also have developmental delays, but we don't. So, okay, I'll be done.
You're fine. I was just seeing if it would work at all. Thank you, Chris.
Yep.
Greg, would you like to go?
Yeah, let me turn my camera on here. All right, I appreciate the invite tonight. My name is Greg Cooney. I'm the Chief Program Officer at Rockford Rescue Mission. Rockford Rescue Mission has been in Rockford for 56 years, and our mission is to share hope and help in the name of Jesus to move people from homelessness and despair towards personal and spiritual wholeness. And we do that through offering a variety of programs. Some of our main programming are our men's and women's crisis centers. We do provide 3 meals a day, 365 days a year, and one of our main objectives is just to meet the physical needs of people who are in crisis. So individuals who need a place to stay, then maybe they were under a bridge the night before, maybe they are fleeing domestic violence, whatever their situation is, eviction. We want to meet them where they are and provide them a safe environment. So those are 2 of our main programs, but we also offer a 9 to 12 month recovery program. We are a certified recovery home through the state of Illinois. So we have both men's and women's recovery programs where individuals can take 9 to 12 months out of their life and focus on the root reasons or the underlying causes of their addiction. As many of you know, the addiction is oftentimes what they're using to cope with the problems that they need to face in life. So we help them unpack that, and we also just take a very holistic approach to programming. So for our crisis guests and our recovery residents, we have an on-site medical clinic, a full-time nurse. We have volunteer doctors that come in. We've started a partnership with the resident students at Mercy Health, where they come in and do physicals. We have chiropractors and dental hygienists that come in, and that's also open to the community as well. And we also have a vocational training center. So we want to help the individuals who are staying with us and the individuals from the community to be able to take the steps that they need to take to gain employment and maintain employment. So we do that through our vocational training center. And currently we have about 90 individuals living at the mission between our crisis and recovery programs. That's about half of what is normal pre-COVID. So we usually have between 175 and 200 individuals a night before COVID, but the vast majority of the individuals who stay with us, well over 50%, report having mental health concerns. So we work very closely with Rosecrance and make sure that they can get the support and the evaluation that they need if they're dealing with those mental health concerns. But yeah, that's the mission in a nutshell. So we don't charge at all for our services. All of our programming is completely free. So we're supported by individual donors, local churches, some grants that we apply for. We don't receive any government funding, but we are just here to meet the physical, spiritual, and emotional needs for those who come through our doors.
I'm sorry, I'm going to be laughing every time because I can't get control of my phone. How about Sarah? Would you like to go?
Sure. Hi, everybody. My name is Sarah Silvers, and I am representing the UI Health Miles Square LP Johnson Clinic, which is at the corner of 9th and East State. My colleague Yolanda Anderson is along with us tonight as a participant. And we have been recently hired as community health workers. And so our mission is to engage with as many people in the community as we can to make sure people are getting the health care they need. If you're not familiar with the LP Johnson Clinic, we are a family health provider, all ages and stages of healthcare from birth to old age. And we are I just lost my train of thought. We work with the residents of the UIC College of Medicine are housed at the LP Johnson Clinic. We have a behavioral health specialist, in a clinical psychologist, and a licensed clinical social worker that we just added this fall. And they are working hand in hand with the primary care physicians to make sure that the patients are getting a well-rounded visit when they come, and if they need mental health, then they can get it. Excuse me, I'm kind of new at this and nervous. Our appointments are basically, they said 45 to 60 minutes with the psychologist, and usually 5 to 20 sessions. The social worker said she can run 25 to 30-minute sessions every couple of weeks, and usually about 12 sessions in her run that she does. We're a little unique because this past May, we became a federally qualified health center, which enables us to take just about every insurance that is out there and serve those that do not have insurance. We have a sliding scale available for those depending on income, and we also are helping homeless as well. We are working as community health workers to build partnerships, and then I think that also makes us a little unique, that we want to find resources So in case the LP Johnson Clinic cannot help, that we have resources so that we can send patients to in order to get the proper care that they need. So we're really looking to build relationships with all of you because we know, as only having 2 behavioral health caregivers, we're kind of limited in the time that we can give each patient. So we're hoping to build the relationships with you all so we can refer people out if we need to. We're also a little unique that we have all the residents that are learning and working with the attending physicians, and since we became part of UI Health Mile Square, we also have resources that come from the Chicagoland area, and we can utilize those and those programs and help get people to facilities maybe that the Chicagoland area has that we don't have here in Rockford. And that's it in a nutshell.
Perfect timing. Good timing. Scotty, would you like to go?
Sure, thank you. Can everyone hear me, I hope? I'm guessing. Okay, my name is Scotty. I'm the Vice President of the Liam Foundation. We are located at 124 North Water Street. We are the first LGBTQIA resource center here in Rockford, Illinois. We got our office in January. We started opening in March. We had COVID, so we officially started taking more clients in June. Our facility assists in filing legal name changes. We assist with gender marker changes, guidance with vital record corrections, coordinate with healthcare providers for HRT. In the Rockford area, most of our community has to go to Chicago for doctors because we don't have doctors that are trained to deal with people in our community. So a lot of times we have to provide transportation for our clients who are looking for HRT, hormone replacement therapy, and we drive them to Chicago so they'll be able to live their authentic life. So unfortunately, the medical field is very behind when dealing with LGBTQ people. And so we help find them doctors, and we also help bring them to the doctors. I am born both genders. It's called intersex. And in order to get good health care, I have to go into the Chicago area because the doctors here don't know how to treat me and my condition. So we help our clients get to their doctor appointments. We assist with transition equipment. So some of our trans individuals, if you're a female to male transgender, we often will buy them binders that will bind their chest up so it will give a more masculine look, and any other thing that the LGBT community might need, we help assist them with. We provide corrections to services for additional needs and resources. We also do trainings for businesses and companies. I noticed that today I had to go get a COVID test, and while I was filling out the paperwork, the gender was male and female, and it wasn't what we would call gender-friendly application because we do have people in our community that are non-binary and they don't identify as a gender. And so they usually, to make that more friendlier, we would go in and we look at people's applications and we would give them a recommendation on how they can make their application more LGBT friendly. So our community will be a little more comfortable when they're filling out applications because an application can be a trigger for an individual. And sometimes people don't know that because they don't have that kind of education, and that's why we're here. We're here to educate companies and non-for-profits that are already in the area. We also have clients that come from small towns outside of the Rockford area because they don't have any LGBT resources in their town, and so we also assist people outside of our town with means if we are able to do that. We also work with other organizations. We help with getting them housing. And that's the Liam Foundation, everyone.
Thank you. How about Shelly?
Hello. I'm going to go ahead and try and share my screen. I think that the slides will be a little bit small. So if there's any way to enlarge those, Danielle, that would be awesome. But if not, that's fine. Let's see. Oh, there we go. Gateway Foundation provides alcohol and drug treatment through our compassionate team of medical and behavioral health professionals at 17 treatment centers across Illinois. The two closest to Rockford are Lake Villa and Aurora. And I should note that we provide residential treatment at those locations. So while they are about an hour or so from the Rockford area, once a client would get into treatment, they're typically with us for 25 to 35 days. If somebody needs outpatient services and wants to participate with Gateway, we are offering intensive outpatient and partial hospitalization virtually, as well as on site. We provide a full continuum of care, including medical withdrawal management, residential, partial hospitalization, intensive outpatient, and sober living. We provide individualized treatment, and we're integrating 9 evidence-based clinical approaches that include motivational interviewing, mindfulness, DBT, CBT, acceptance and commitment therapy, trauma therapy, medication-assisted treatment, and 12-step facilitation. We employ licensed professionals, including on-site psychiatrists, nursing, and master's level therapists. We treat adults in gender-specific and co-ed groups, as well as a new specialized programs that include LGBTQ+, which is called Out in Recovery, and that is available at our Lake Villa Treatment Center. Women and Trauma, Professionals, Young Men's, which is a bridge program for ages 18 to 26, also available at our Lake Villa Treatment Center. And then one specifically for alcohol use disorder, and that is available at our Aurora Treatment Center. Here's just a picture of our men's professionals, Out in Recovery, and then our bridge program. A picture of our Lake Villa site, really pretty treatment center location on about 45 acres on a lake. We have achieved, this is really important, criteria necessary to be considered dual diagnosis enhanced at all treatment center locations, meaning that we can treat people who struggle with co-occurring mental health disorders. And we get really high patient satisfaction scores using Press Ganey. We're able to accept commercial insurance, and we're in network with HMOs and PPOs, self-pay, and we do base that on financial need, Medicaid, and super funding. To make a referral to Gateway, you can call our 24-hour helpline, that 877-505-HOPE, or you could call me directly and I can help guide the person through the process. Thank you.
Thank you, Shelley. Nathaniel, do you want to go next?
Certainly.
There she is.
All right. Well, good evening, everyone. My name is Nathaniel Bobel. I am a community outreach worker with Prairie State Legal Services. Prairie State Legal Services is a nonprofit organization which provides free civil legal services to the most vulnerable members of our communities, including domestic violence survivors, older adults, veterans, people with disabilities, and other low-income individuals and families. We provide these services through 11 offices, which serve 36 counties in northern and central Illinois. We focus our services on basic human needs such as health, housing, safety, and stability. Just a few examples of the ways that we can help clients include helping domestic violence victims escape abuse, helping veterans secure the benefits that they have earned, helping families avoid illegal evictions or improper foreclosures, and helping older adults avoid discharge from nursing homes. Our organization serves thousands of clients every year. Sometimes we provide clients with legal information or advice over the phone, and other times we'll represent a client in court. It really just depends on the particular needs of that client, as well as the resources that we have available to meet those needs. Prairie State is committed to advancing equity and inclusion for all marginalized groups. In 2003, we launched a Fair Housing Rights Education Project, which evolved into a Fair Housing Enforcement Project in 2013. This project enforces the rights to fair housing under state and federal law for all protected groups, including race and people with disabilities. In 2014, we developed a Racial Justice Task Force to focus on racial equity in recruiting and hiring, internal operations, and racial justice legal issues affecting our clients. So this task force has provided action items for our organization, presented extensive training for our staff and others on a range of equity and inclusion issues, and has helped support our litigation efforts to advance the rights of our clients. So our organization is essential to our community's mental health because many of our clients have serious mental health needs and would be seriously disadvantaged in navigating the court system without a lawyer assisting them. And in addition, helping clients with their civil legal needs has a significant impact on their mental health. For example, helping someone get medical benefits allows them to receive treatment and medication that they could not otherwise afford. And helping a young mother escape an abusive relationship can have a positive impact on her mental health along with her child's. So that's just Prairie State in a quick nutshell. I hope that was helpful information, and thank you for the opportunity to share with you all.
Thank you so much. Lynn?
Hello, everyone. My paper's here in front of me because I can't do this without reading, even though I've done this a while. I'm Lynn Riley. I'm the LIC coordinator and parent liaison at Child and Family Connections. Our early intervention grant was awarded to Youth Services Network last summer. We are located in downtown Rockford. We serve 6 counties in northern Illinois: Winnebago, Boone, Ogle, Bureau, Marshall, and Putnam. The Child and Family Connection offices are the point of entry for the federal early intervention program in Illinois. We serve children under the age of 3 years who are experiencing developmental delays and disabilities. The primary services we offer are physical therapy, occupational therapy, speech therapy, developmental therapy, and service coordination. We have 13 other additional services that are available to support the children to reach their age-appropriate developmental milestones. Referrals can be made by anyone in the community, directly by the family, the doctor, child care programs, school districts, the health department, or other social service agencies. And early intervention has 3 eligibility classifications. A child can be eligible for services if they have a diagnosed medical condition that results in a high probability of a developmental delay, if they have a documented developmental delay of 30% or more in one or more childhood developmental domains, or if there's documentation of at-risk status. A subcategory under the at-risk status is specific to the parent and why I asked to participate tonight. If the parent has a medical diagnosis of a developmental disability, or if the parent has been medically diagnosed as having a mental illness or serious emotional disorder defined in the DSM-5 that has resulted in a significant impairment in the parent's level of functioning in at least one major life functional area, that will make the child eligible to receive early intervention services. Service coordination and the evaluations are provided free of charge to the family. Early intervention supports and services are paid by a variety of funding sources, including the EI program and the family's private or public insurance. Some families may be charged a fee based on their family size and income. The service coordinator would discuss the fee with the family prior to implementation of ongoing services. If a child is determined eligible for EI services, the family works with a team to develop an individualized family service plan that will link the family to providers in the community and supports that they choose to help their child learn and grow. As the child nears their 3rd birthday, we then contact the school district where the family resides to help determine eligibility for services through the school's early childhood programs options. Children continue to receive early intervention services up until the day before their 3rd birthday, and then on their 3rd birthday, if school's in session and they're eligible for those early childhood classes, they're sitting in a seat. Not that 3-year-olds ever sit anywhere, but they've got their spot there in school. We provide services and documentation to family in their native language, and the EI program does not require proof of immigration status. Our goal is to really help the family help their child in all areas of development, which has benefits for the child, for the family, and the community as a whole. Excellent timing.
Yes. Good job. Thank you. Renee, would you like to go next?
There. Yes, I would love to go next. So first, thank you, Danielle, so much for inviting me to this tonight. It's so nice to see some faces that I've emailed with many times. So it's nice to make those connections. I'm Renee. I'm the Winnebago County Services Manager for RAMP, and RAMP is a nonprofit center for independent living that opened in 1980. We are funded through state and federal grants, along with donations and fundraisers that they kind of play a huge part in making us self-sustainable. We also have offices in Winnebago, Stevenson, DeKalb counties, and we serve individuals from those 3 counties along with Boone County. We just recently closed our Boone County office because we weren't getting very much foot traffic there anymore, so it didn't really make any sense for us to still have that open. Our mission is to build an inclusive community that encourages individuals with disabilities to reach their full potential. And our tagline is something that you might know us by, which is no limits. And something else about RAMP is that we take a creative approach to find resources and opportunities to team up with other individuals with disabilities along with other entities in the community. We have knowledge that plays a huge role, and the majority of our board and staff are also individuals with disabilities. We advocate for the implementation of current laws and promotions of most needs for legislation and improvement of existing systems for people with disabilities, while working to diminish the negative attitudes that threaten to impede the equal access in our communities. So we offer a variety of different services, so I will try to run through them as quickly as I can. I probably won't get through all of them, but we'll try. So first and foremost, we are an information and referral center. So we want to be able to have anybody really, our consumers or our other entities we're working with, other agencies, be able to call us, and we're kind of providing that program information or that resource to them, or making that connection and bridging the gap between services. We offer peer support. There are many times that consumers will come to us and they just want to speak to someone that has been through what they've already been through, and that just helps them kind of get over that barrier, over that hump, so they can reach their goal. We have our individual and systemic advocacy. So this is the implementation of, we advocate for the implementation of current laws and promotion for the need of legislation to improve the existing systems for the people with disabilities. Independent living skills training. This is kind of the heart and soul of the IL philosophy. So we are kind of giving that control back to our consumers, and we're teaching them new skills to empower them to use their techniques to live out in the community independently. We also offer quite a few different employment services, and this is designed to assist people with disabilities to find employment by job readiness skills, benefit counseling, job development, and case management. So we also have like Ticket to Work and Fast Track. We partner with RMTD, and we do bus training. And we also assist with bus training not only in Rockford, but we do the SMTD and then also the Keenage Center and paratransit. See, I told you I wasn't even going to get close.
It makes me feel so bad doing that.
No, it's all good.
If everyone that's speaking tonight wants to provide me with anything that I can send to the attendees after this too, I'd be happy to do that for you. And also we'll have some time for questions. Amanda?
Sure, let me get my video back on. It says my host has stopped the video. There we go. All right, hello. My name is Mandy Hahn, and I am the owner of Dahlia Center for Perinatal Mental Health. So we are brand new, opening up this month that we'll start seeing patients. And we will specialize in perinatal mood and anxiety disorders. So I am a certified nurse midwife and also a psychiatric nurse practitioner, and I am also perinatal mental health certified. So in my experience as a midwife, I've really noticed that there's this big gap between psychiatric care and obstetric care, and the patients kind of get left in the middle. And more research is showing that depression, anxiety, OCD, trauma have very real effects on the pregnancy. 20% of pregnant patients have a perinatal mood and anxiety disorder, and it is the most common complication of pregnancy. But only 8% of patients receive adequate treatment. So I'm hoping to bridge that gap here. I will provide medication management, some supportive therapy, and then also specific birth and postpartum plans for patients with histories of trauma and the perinatal mood and anxiety disorders. We are right now out of network with insurance. I'm hoping to work on getting in with some of the managed care organizations and Medicaid. And then we are also doing telehealth right now, so anywhere in Illinois. I'm located in Rockford, but especially with COVID, hoping to open it up to the whole state. We do offer some sliding scale right now, and as far as I know, I think this will be the only place that's specific to perinatal mood and anxiety disorders in the Northern Illinois area. So I am, open for referrals. I'm open for consults, and I'm always happy to help. So thank you.
Thank you. Joan, would you like to go next?
I would love to go next. Thanks, Danielle, for having me. So I'm Joan Lodge. I'm from Rosecrans. Rosecrans is a private, nonprofit behavioral health organization with more than 60 sites in Illinois, Iowa, and Wisconsin. Rosecrans is a comprehensive behavioral health network serving more than 40,000 families annually. Rosecrans offers addiction services for adolescents and adults, including prevention, intervention, detoxification services, inpatient and outpatient treatment, experiential therapies, dual diagnosis, treatment, and family education. Rosecrans offers high-quality outpatient mental health services for individuals of all ages through programs such as screening, assessment, therapeutic mentoring, individual therapy, group therapy. We have school link services, and we have numerous intensive community-based treatments. We offer psychiatry and additional crisis intervention and supports when needed. We address individuals' needs from the first point of contact, really, by first conducting an assessment. This assessment process really is the key to ensuring that we match the individual's clinical needs with the appropriate level of care that they're seeking. Our residential stays typically last about a month, while our outpatient services vary depending on the individual needs and what they have at that time. In the Rockford region specifically, our network of facilities offer extensive services for individuals of all ages. Rosecrans aims to meet the specific needs of each individual, to create a highly individualized treatment plan, and provides services along the continuum of care. This extensive network locally in the Rockford region includes inpatient, outpatient facilities, residential recovery homes, a crisis response facility through our Rosecrans Mulberry Center. We pride ourselves by forming strong community connections with schools, local police, fire and emergency departments, and other healthcare providers. We accept most private insurance plans along with Medicaid managed care. We also receive funding through the state of Illinois through the Department of Human Services and super funding. Our staff are trained to work with clients and fellow colleagues of different backgrounds. Our experts have also presented nationally on the topic of treating LGBTQ clients in residential care. Our staff are trained on the principles of trauma-informed care. The reason for this is to ensure that our staff are promoting safety and demonstrating that we value clients' well-being from a trauma-informed perspective. We provide treatment and supports for almost anyone with mental health needs, and we work closely with other agencies, many of you are on the call tonight, to make sure all people can find the care they deserve. Our services help people's immediate needs with the goal of providing lasting, life-changing recovery. We strive to provide a voice to the most vulnerable who sometimes are not heard. So I very much appreciate you being here. Thank you.
Good timing. Rebecca, would you like to go next?
Sure. Hi, I'm Rebecca Quirk, the Administrative Director for Along the Path Counseling Services. Along the Path is a small mental health practice located at 433 South Phelps in Rockford, and we provide individual, couple, and family therapy. We are an inclusive organization and ally for the LGBTQIA+ community. We strive to make therapy accessible, and during this time, for some, accessibility may mean having sessions through telehealth, or it may be needing to be seen in the office. We also have day and evening appointments and are in network for many commercial plans. Out of network is also an option. Sessions are generally 45 minutes to an hour long. Sometimes you just need to step out to gain a different perspective, and we provide a space, virtual as well as physical, that is open to listening to your story and helping you along the path in life. As I mentioned, we're a small practice and currently have 4 therapists, Jason Peckles, Stephanie Yates, Andrew Culhane, and we are pleased to share that Jennifer Mitchell is joining the practice this month. She will be starting to see clients the week of the 19th. Jennifer is a licensed marriage and family therapist and has experience working with individuals, couples, children, and families. She utilizes a trauma-informed and attachment-based approach with her clients. She also has training in EMDR, TheraPlay, trauma-focused cognitive behavioral therapy, as well as other treatment options. Stephanie Yates recently passed her exam and soon will be officially an LCPC, a licensed clinical professional counselor. She is also pursuing her PhD in counselor education and supervision at Northern Illinois University. Stephanie's experience and specialties include families, relationships, children, adolescents, sexuality, and alternative lifestyles. Stephanie uses a combination of psychodynamic and ACT techniques. Andrew Culhane is a pre-licensed clinician who is under Jason Peckles' supervision. Andrew has a background in philosophy and works from an existentialist perspective with a person-centered approach. His approach is grounded in the belief that people have the capacity for self-awareness, that our identity is known through relationship with others, and feeling authentic allows us to change. Jason Peckles founded the practice in 2009 and has been a counselor for over 18 years. Jason's focus is on treatment of anxiety disorders, depression, and traumatic stress. He is trained in EMDR, acceptance and commitment therapy, as well as mindfulness therapy. Some of his interests include exploring the connection between the environment and mental health. We have a great team of therapists who collaborate and challenge their clients as well as each other. Everyone is traveling along the path of life. Sometimes the path we're on is a struggle, and we just need someone to help us navigate through life's challenges. And Along the Path can help you along the way. Thank you very much for having us.
Perfect for you too. I saw Baldemar jump on, but I think he might have signed off. So did I miss anyone besides myself and Xavier? Okay, so I'm gonna go next because Xavier is gonna close this for us. So I'm Danielle Angelari, again, Executive Director of NAMI Northern Illinois. We're an affiliate of the largest grassroots mental health organization in the US, the National Alliance on Mental Illness. Our local affiliate was born in 1984. We are dedicated to improving the lives of individuals living with mental illness through offering support, education, advocacy, and hope. We also act as a resource line and a liaison to the next step in an individual's mental health journey, and a warm place to be heard. We do not offer clinical services, but we offer several support groups for people living with their own mental health conditions, ages 18 and older, as well as family members and loved ones who find themselves in a caregiving role, because mental illness, as we know, impacts the whole family. We have lifetime members, those who stay until they feel like they can stand on their own, and some people who just stick around for a little while. All of our support, education, resources, and advocacy services are free of charge. Mental illnesses do not discriminate, and neither do we. We're a safe place, open to any demographic you can fall under. And in reflecting on inclusion and equity in our services, we consciously and continually educate ourselves on important issues and make intentional connections and relationships in our community. So the thing I believe that makes us the most unique is we are lived experience driven. In the recovery movement, the concept of lived experience means that those who have a mental health condition, those who are trauma survivors, suicide attempt survivors, family members, those that surf the waves every day are actually the experts. Lived experience knowledge encompasses things like understanding marginalization, oppression, and discrimination that comes with living with mental illness. Other things to consider in that realm are people with their own lived experience don't have the same power imbalances, and they actively challenge existing dynamics to promote more equitable care. People with personal lived experience can empathize and advocate on behalf of those currently unable to do so. And research indicates peer roles contribute to an improved sense of hope, empowerment, and social inclusion for those accessing services. And at NAMI, lived experience is included as a guiding force that shapes our services and how they're delivered. And that's all from me. Xavier, last but not least.
All right, hi everybody. So my name is Xavier Whitford and I am the founder and executive director of the Tommy Carell Memorial Foundation. We're a very small local foundation, a nonprofit that was established in 2014 after we lost our son Tommy to suicide as a result of his battle with depression. Some things to keep in mind is since our foundation was established, we've been working very hard in the community to increase education on the factors that lead to suicide and create resources to help those struggling with mental illness and suicidal thoughts, along with providing funds and opportunities for many community members to get certified in mental health first aid in order to become prepared and equipped to handle mental health crises. The foundation also provides financial support to individuals needing counseling with no insurance. We've been able to build and establish relationships with local counseling groups to get reduced rates in which people are able to go and see counselors and they bill us directly because that individual either is in between insurances or does not currently have insurance, and we don't want that to be a barrier to people getting the mental health help that they need. Some other things that we do in the community is we've collaborated with a lot of different organizations, such as NAMI for our group Hope meetings. We do teen and young adult support group meetings. Our foundation also does a mom and dad's grief group support that meets once a month. We, again, I am a mental health first aid instructor, and so we often provide funds and free of charge training for individuals, organizations, or businesses that want to be trained in mental health first aid. We do suicide prevention billboards in the month of September during Suicide Prevention Month to help break the stigma and the silence surrounding the topic of suicide. We also do a lot of legislative advocacy and meet with, we've been to Washington, D.C., as well as down to Springfield to meet with legislators in order to improve communication and change state and federal laws around suicide prevention and mental health. Some of the things I wanted to also point out is we are supported solely by donations, and the 2 fundraisers, 2 to 3 fundraisers we do annually. So every year in April, we do the Each Breath of Faith 5K, 3K, which is a local walk, family-friendly, dog-friendly walk. And then in August, we do the Ride to Fight Suicide. And that's a ride that we do that is within Winnebago County. It involves different vehicles and motorcycles, and we have a great time, and we provide education resources and information to individuals that may not be aware of what we do. But one of the things we really pride ourselves on is with all of our fundraisers, we invite other organizations to be there to provide information to the community about what they have to offer too. We're very much collaboratively driven to work with other organizations. We look at ourselves as a resource director. So oftentimes we cannot provide the resource or the counseling or the connections that the person needs, but knowing what's available in the community and being able to connect them with what they need is very important to us. So we do a lot of work, and to achieve our goals of increasing understanding, empathy, and providing supportive services, we partner with charitable organizations that support families and individuals living with mental health and suicidal thoughts. So I just want to thank you. I'm going to switch my hat now because I also sit on the NAMI board, and I have the privilege of being the Mental Illness Awareness Week chair. And so this was just an awesome way to add to our week and all of the things that we had going on. We've had a great week of alternative therapies that were presented to us, from dance and music to yoga to art, and now people are getting introduced to different social services that are available. And to be honest, you know, I try to find out as many of the social services that are available in our community, and there were a few on here tonight that I was not aware of. So this was exactly what it was about, is to make sure that these all of these great organizations that are doing great things are able to be connected with people who may need their services. So thank you all for being here for tonight. Thank you all for taking the time to present what you have to offer to all of the attendees, as well as other panelists. We do want to thank Danielle too for doing such a good job on timing us tonight and keeping us on task. But I do want to just invite you all, before we wrap up, to tomorrow at noon, while you have your lunch break, join us for the virtual mental health, Mental Illness Awareness Week rally. We're going to have several speakers. We're going to have some music. We're going to have, it's going to be an awesome time. This is my favorite week of the year, and this is my favorite way to wrap up this week. So please join us. It'll be around an hour. There's going to be a lot of great speakers, a lot of great information, and it's all virtual. And you can find the information on NAMI Northern Illinois under Mental Illness Awareness Week. So we hope that you'll join us tomorrow, and we want to thank you for being with us tonight. You guys have a great night.